You were involved in an interaction with a psychiatrist at Children's Hospital of Eastern Ontario. Can you tell us about that experience?
So what happened was my daughter had been, I had initially taken her to the mental health clinic at the Children's Hospital of Eastern Ontario to be seen for depression when she was 14. She insisted on attending these appointments by herself. I mean, after we did the initial intake and whatnot. So she attended like 3 appointments where I would just kind of hang out in the car and have coffee or something. And then when I went in to do a checkup with the clinicians, I found that she had been referred to the gender clinic without my knowledge. We attended a few appointments there where they tried to browbeat and gaslight me. And then we stopped going. So about a year and a half later, I deployed to Iraq, and while I was in Iraq, the Children's Hospital of Eastern Ontario started calling my daughter's phone directly because she just turned 16, which is the legal age of consent in Ontario, and they told her that she didn't need my permission anymore. She could come back in to continue down the path of biomedical transition. So I attended those appointments. I actually took early leave from Iraq to see Dr. Stephen Fetter, who was the head of the department there, and he offered puberty blockers on the first appointment and was actually quite aghast that I had any questions about it and gave me kind of all the same woke answers that we're all so used to hearing now about how puberty blockers are perfectly reversible and being transgender is analogous to being gay, which it is not, of course. One is a preference and the other one is an epistemological claim. So so I attended a few more appointments like this. I recorded the appointments that I attended after that initial one. Stephen Fetter, he told me that when I asked him, how he knew that my daughter was in fact a male trapped in a female body, he said that he had looked into her heart and soul. And when I asked him how he knew that a soul existed, he said, I don't have to answer that question. And things escalated from there. We were referred to endocrinology, where Dr. Maria Keeley told me that, that the puberty blockers would be reversible. When I again asked for some kind of evidence to support her claim, she said, we're not going to be able to give you that evidence. She was quite contemptible and I would say psychologically abusive even. And, when I tried to raise concerns, she would ask where I was getting this information. I said I read up on it. I read some studies. And she said, that she would provide me with studies to support her claims. And when I showed up for the next appointment with a stack of papers about that thick and put them down in front of her, she ran out of the room. So that was the last time that we attended. Thankfully, COVID was our saving grace. But if you listen to the recordings that I made, I think it's pretty clear that they are ideological fanatics and acting in that capacity as opposed to acting in their capacity as doctors.
What happened with COVID again?
Well, the appointments stopped, despite all their claims that my daughter was going to commit suicide if we didn't transition her. It seems it's not as life-saving as they initially let on, because when COVID hit, they weren't bringing her into these appointments to save her life.
How is she doing now?
Not well. She is 23 now and has been living with her mother for the last few years. She cut off contact with me in 2023, and she just had her healthy breasts removed last September. That I don't know, because I'm sure she probably would say that. However, I would also say that that 23 is still too young based on my understanding of the data. Well, 22 would have been when she had the surgery, but there's an 88% rate of desistance by age 23, and by age 25 that goes up to about 93%. So all of the data that we do have shows that the overwhelming majority of people will overcome this through the natural process of maturation.
Caleb, you keep throwing up this headline here. What is that?
Yes, it's breaking news that came in just a few hours before our show, where it's the FTC is suing WPATH, the trans medical group, for misleading guidance on gender transition for minors. And I think multiple states are involved in the lawsuit as well. It just came out a few hours ago.
And based on new data, or what is this based on?
From what I was able to read briefly right before the show, it's about fraudulently presenting misleading guidance. So it's misleading data and presenting it as these are things that have been proven already, and suppressing studies and not releasing them, like what happened, I believe it was a year or two ago with the Children's Hospital of Los Angeles researcher. When it didn't agree with the narrative that they wanted, they just withheld the whole study entirely, which is not how science works.
Right. Well, it's how science works these days. And, medicine is, and you talked about the fourth turning, Jeff. One of the things that's falling apart is medical literature. And there was a study Vinay Prasad reviewed from JAMA Internal Medicine that was making the claim that multiple COVID boosters reduced cardiovascular risk at 10 days, I believe it was. But in any event, it was a just deeply flawed study, and that gets published. And studies that want to look at the risks don't get published, of course. And are you having difficulty? It sounds like you're going through the medical literature. How do you find that experience?
Definitely eye-opening. It's shocking how out of step the standards of care. That's what they're referring to in that article there. It's the Medicalisation. That's it there. It's the World Professionals Association for Transgender Health. And Mia Hughes is a personal friend of mine. We actually organized, I and my small team of volunteers organized an event in Ottawa on the 5th of May called Mayday Kids in Crisis, where we sought to bring an end to childhood transition in Canada. And Mia was one of our expert speakers. We did a parliamentary press gallery in the morning and a rally in the afternoon, and then a town hall with a panel of experts and those with lived experience of the harms of gender ideology in the evening. The whole day went off without a hitch, thanks to my excellent and dedicated volunteers. But Canada is an outlier, actually, in this regard. I see the United States is turning things around, and we've already seen Sweden, Norway, Denmark, the Netherlands, Spain, Italy, the UK taking steps to reverse course on this as well. But Canada continues to double down. And we actually have a very odious law in Canada. Bill C-4, conversion therapy, was passed in 2022. I think it reached royal assent, passed in 2021. But any parent who tries to who takes their child to a therapist for a talk therapy to alleviate their gender dysphoria faces 5 years in jail. So does the therapist. And any parent who takes their child out of country to be seen by a therapist faces 5 years in jail for doing that in Canada. So it's leading to a lot of problems, as you might expect, especially where, people have comorbid conditions in addition to their gender dysphoria. They might also have other conditions, but to be able to explore that would be to break the law, essentially. The only legal option is biomedical transition. And my read of the literature is that post-op transsexuals, the marketing on this is around preventing suicide, but post-op transsexuals have suicide rates about 19 times that of the general population, and even other health complications resulting from the transition will eventually kill them. They only last about 10 to 12 years after the transition, and about 8 years out is when the suicide rate really starts to spike. So this is inhumane, what's being done, especially to kids, and it needs to stop.